for this program. And to give a brief introduction to the ECG conference, no, ECG is a forgotten art. Everybody thinks that ECG is a dying art. It is not true. When I was a student, there was not much interest was given to the ECG. But after the invention of electrocardiology, especially the electrophysiology, we are able to learn much more about ECG. So that is the reason we have an annual, we have the conference here. I hope all the delegates will enjoy this conference, and their knowledge level will be definitely going to go up with this conference. Thank you all.
Thank you, sir. On this onset, let us begin today's program with the lighting of the lamp by the chief guest. I request the dignitaries to join.
I now request our chief guest for today, Dr. M. Venkatraya Prabhu, Dean, KMC Mangalore, to deliver the inaugural address.
Good afternoon, everybody. Reverend Father Patrick Rodriguez, who is the Director of Father Muller's Charitable Institutions. My own colleague, the Dean of the College, Dr. J.P. Alva. The Head of Department, Dr. Venkatesh. Reverend Father Richard Coelho, who is the Administrator of Father Muller's Charitable Hospital, and Reverend Father Rodolphe Ravidessa, Administrator of Father Muller Medical College. And of course, our own good friend, Dr. Prabhakar, who is the force behind organizing this event, as well as several of my friends who are here, alumni of KMC who are here, as well as our own postgraduates, as well as all the faculty members of Father Muller's Medical College, as well as delegates who have arrived from elsewhere all over India. It is my proud privilege to stand before you to say a few words on this occasion. And let me first of all thank Dr. Prabhakar, who has invited me for reasons best known only to him, because I don't find myself to be the most eligible person to do this job, but of course, due to his graciousness, I am standing before you. Let me first bring you greetings from my college and my organization. Greetings to you from Manipal University and the two Kasturba Medical Colleges, Manipal and Mangalore, which are jointly observing our Diamond Jubilee year this year, starting from June 30th through next year. And therefore, this occasion is very special for me to convey our greetings to you as the first alumnus to head the institution as the Dean of Kasturba Medical College, Mangalore. So greetings to all of you. Having said that, I must first of all appreciate and place on record the great work Father Muller's Medical College has been doing during its inception, starting from its inception as a medical college. Before that, everybody knows that it has observed a centenary of service in medico-social relief, as well as it has done a wonderful job over the last 100 years, and during the centenary year, it was Mother Teresa who herself came and placed on record what a good job you have been doing. But I am only speaking of the last 15 years of the Father Muller's College's existence as a medical college. It has achieved advances in leaps and bounds, and it was one of the first colleges to have been given the status of a postgraduate teaching center much before the medical college started. And now, of course, you have shown the advances in research and also holding academic events of this kind, which get faculty like all of us together and try to sharpen our brains. This is very important for you to understand, because it is not only the need of the hour, but it is going to be mandatory for recertification of a medical professional once in 5 years to earn 30 credit hours, and then only one can keep one's practicing license intact. This is going to happen. Nobody can wish it away. And as was told by the author of Robinson Crusoe, that is Victor Hugo. Victor Hugo was the one who said, no man can stop an idea whose time has come. Time has come to see that the medical professionals are mandatorily re-accredited once in 5 years by putting in the required number of credit hours. There is no escaping that fact. And CMEs like us, CMEs and workshops like this will give us an opportunity to earn those credit hours apart from listening to learned people in the field and getting to know what is new, and not to forget the basic issues like reading of the ECG. Even in that field, I think one has to keep on learning. Having said that, I would like to compliment the team of Dr. Prabhakar for having got this event here for the first time. And I am told that a galaxy of speakers will be there starting from today and right through tomorrow and thereafter for half of the following day. And these are very learned people who have accomplishments in their field, and it will be an academic festival. Now, there are a lot of youngsters here, so I think I will be deviating a little from what I am expected to say on inauguration of this event, because it is not just the knowledge of the science which makes you perfect. Medical science alone, that doesn't make you perfect. You have to have a lot of things which go with our profession, that is compassion, human values, and a good Samaritan spirit. All these things are important, because it is not just your knowledge which cures the patient. There is a saying which is told in certain contexts, that is, cure rarely, comfort mostly, console always. That is, a patient who has come to you should get better not only by your knowledge but by how you interact with the patient. So nowadays, as the dean, when I get the inquiry from overseas universities to recommend my students, 2 things stand out in their questionnaire, which have nothing to do with the score or rank in the medical profession or their ECFMG scores, nothing to do with that. It's something to do with the qualities, human qualities. These are ability to work in a team, how effective you are as a team member, because you can be a great person, but as a team member, if you don't, if you are unable to function, and when you say team, your head, your senior people as well as the people who work under you, including nursing staff and all others. So how well you function as a team, as a part of the team. Another one important attribute is, Harvard University, Massachusetts General Hospital, there is one thing, grade the sense of humor in this person, 0 to 5. Grade the sense of humor, 0 to 5. The reason is obvious. If you want to get into profession, you have to be cheerful enough yourself and then make the patient feel better. Nobody wants in the American hospital to get a person who is depressed and morose and cause further depression in a given patient. So that's the first thing that I want to tell you. All the investigative advances which have happened, definitely they are most welcome. The high tech is most welcome. It is going to supplement but not substitute these basic human values and the good Samaritan spirit, of which I don't need to lecture you about. Having said that, few more things I would like to, of course, while at the sense of humor, I think I'll not be deviating if I say something. When I saw Syed Killer this afternoon, I thought, I am not dressed for the occasion because he's smartly suited for this occasion, and I'm, and that reminded me of a joke. It really happened. It's not a joke, it's an anecdote. It seems, Mahatma Gandhi was known for his simplicity. That is, he used to wear only loincloth, nothing more than that. And he used to think that Gandhi's Jayanti is round the corner, so it is appropriate to think of Gandhi. So he used to think that when his countrymen are suffering, he should not live in luxury. This was the principle behind it. So Sir Winston Churchill, the then Prime Minister of England, referred rather derisively, Mahatma Gandhi referred to him as a half-naked fakir. This is exactly what he said, half-naked fakir, because he was real pain in the neck for the British, because once he goes on fast, the entire country will be on flame. I'm talking of those days when Gandhiism was truly Gandhiism. Today's is a totally different thing. So, Mahatma Gandhi went to Round Table Conference, 1929-30, thereabouts. And he went like that only, what Churchill referred to as, in loincloths. And he went to Buckingham Palace and sought an audience with the King George VI, I think. That time Queen Elizabeth was yet to rise to the throne. So King George VI. So at the footsteps of Buckingham Palace, Gandhi was asked, how do you feel, Gandhi, Mr. Gandhi, how do you feel? Because the British won't refer to him as Mahatma Gandhi, because they don't want to, that was a title given by Rabindranath Tagore to Mahatma Gandhi, to Gandhi, but there they referred to him as Mr. Gandhi. How do you feel on this occasion like this? He had a great sense of humor. He said, there is no problem. The king is wearing enough for both of us. King's flowing clothes, is wearing enough for both of us. There is no problem at all. What is the problem? He asked the journalist. Journalist was a shut-up call. So that is called Gandhian sense of humor, And not only that, those days there were no flights and all. He had to go by ship and then come back. While coming back, he went to Italy. The ship stopped there, Naples or somewhere. Then he went to Rome, and he sought an audience with the Mussolini. Mussolini's grandchildren were there. And you know how children are. They won't suppress it. When they saw Gandhi in that form, they burst out laughing. Then Mussolini admonished or chided the grandchildren and said, don't do like this. This man is now shaking the British Empire, the mighty British Empire. So that was what Gandhi was all about. So when I saw you dressed for the occasion, I thought I'm not dressed for the occasion, and I was reminded of that. Now this one, a small anecdote I will tell. The present Pope Francis, when he was a child, his mother had some kind of a paralytic illness and she was bedridden. So she used to direct him as to how to cook, put some salt here, pepper there and all that. So present Pope Francis is a good cook. So somebody asked him recently, how is the cooking that you are doing? Pope told, nobody has died, so that must be good. So that is the sense of humor that these great people have. Great people have great sense of humor. So in medical profession also, when you deal with the patients, you should have a sense of humor and you should be able to work as a team. Now coming to the topic itself, now electrocardiogram, it was an invention of the 20th century. Mostly up to 19th century, medicine was practiced as an art, that is inspection, palpation, percussion and auscultation. The turn of 20th century, the X-rays came thanks to Konrad Röntgen in the year 1898. And there was no looking back ever since, and imaging techniques came one after the other. Electrocardiogram thanks to William Einthoven, for which he got the Nobel Prize in the year 1923. But remember, don't ever be glorified by the Nobel Prize because it is coming from tainted money. You know very well that the person who endowed all his things, all his property to Nobel Prize was Alfred Nobel. And I don't know how many of you know the reality or the truth as to what happened. Alfred Nobel made his money based on dynamite. And he had a brother called Ignatius Nobel. Ignatius Nobel died before Alfred Nobel. But it was picked up by the journalist as Alfred Nobel died. So Alfred Nobel read his own obituary. Alfred Nobel no more, quote unquote, angel of death is no more. This is what he saw in print. Very few of us will have a chance of reading our obituary while we are alive, because it doesn't come when you are alive, it comes only after one dies. So he saw that, and that was the turning point. So he gave his entire property, everything to the Swedish Academy, which announces the Nobel Prize, which is round the corner. October 3rd to 10th is called Nobel Prize week. And right now the guessing is going on who will get the Nobel Prize for medicine and physiology this year. But in the year 1923, Nobel Prize was won by, or was conferred to upon Einthoven, who was the inventor of electrocardiography. But here I must tell you, initially, the Nobel Prizes given were for immediate, something happens today, tomorrow they will get the Nobel Prize. That led to some problem. In the year 1926, Austrian man called Julius Wagner was given Nobel Prize for this particular thing. You will be shocked. Treating general paralysis of insane, that is neurosyphilis, treating that with injection of Plasmodium falciparum and causing a violent fever to kill the spirochetes in the brain. It looks barbaric today. It looks barbaric that you use a biological warfare. You inject malaria and kill the spirochetes. But remember, at 1927, when this Nobel Prize was given, penicillin was yet to be discovered that year. So at that point in time, it looked like an advance, but it was not at all an advance if you really look at it. And therefore, Nobel Academy woke up to reality that any new thing should withstand the test of time. So Alexander Fleming, for his discovery of penicillin in the year 1927, was conferred a Nobel Prize only in 1944. That much time. And the one who discovered HIV, that is Luc Montagnier, they got that was in 1981. They got the Nobel Prize only about 23 years later or 25 years later, very recently. So though it is the dream of every researcher here probably to get a Nobel Prize, remember the source, it comes from dynamite. And that is what you should know. That is, any advance which happens should be for the good of the humanity. Now coming to the ECG and my own interest in ECGs. When I was an intern, there are two people who made me learn ECGs. One is Dr. Keshav Bhatt. I think he is well known to all of you. He is now leading a retired life, but he was a professor of medicine in our college, and he kindled the interest for a postgraduate like me in the first year. He kindled that interest and made us aware of the requirement or the need to learn the ECGs. And not only that, our senior postgraduates